Do you find yourself swept away by the constant change and turmoil around you? Whether personal or professional, these challenges can keep us from living a life of peace and productivity. I'm Liz Herl, a licensed clinical marriage and family therapist, and I want to show you data-driven strategies to help bring stability and peace to your life. Welcome to the Anchored in Chaos podcast. Hello, everyone. Welcome back to Anchored in Chaos.
Hey, Liz.
I'm your host, Liz Herl.
Liz?
And you are my co-host.
Dr. Tim Caldwell. Hi.
So we are going to tackle something today that, many women, I would definitely say, are managing and working through, including oneself. And that's why I was just sharing. I might intermittently, if you're not watching, you'll never know that I go between some special glasses that I now wear versus what I used to not.
Special glasses.
Yes, it's for superheroes. You wouldn't.
Yeah, they're like
they only get
glasses.
they only get assigned to superheroes.
See, I've worn special glasses my whole life.
Yeah, but
Liz.
I don't think they're that of my caliber of superhero-ness.
No, yours are way specialer than mine.
All right. Well, what we want to kind of dive into in a more intentional manner is really women's health overall. We're going to hit on the physical, mental, emotional, and that is really of women that's going through the change of life, as they call it.
Menopause.
Menopause.
Yep.
And it's really all over right now.
Mm-hmm.
And being an individual that is experiencing that's been really enlightening and really, personal growth of what people really struggle with through this and the health of women. What happens to women? Not just the reactional behavior that everyone says, like the crazy woman or the hysterical woman or the psychotic woman, which are that's really unkind in the fact that there is a reason for what is happening. And when you feel outside yourself, what is really going on. So to kind of start that off, we're looking at women, really the onset of menopause, right? Is between the age of 45 or 40 to 45, but on to 55. Because up until then, you're perimenopausal. So perimenopausal is?
Essentially, if we were to look at, historically, if we look at baseline, a female patient, let's say, clinically comes in and we take her blood, a blood panel then represents exactly what her ovaries are doing as far as development of ovaries, release of ovaries, which would be the menstrual cycle, which then goes on to the point where that cycle, a woman's cycle, begins to taper off and be altered, which means that the primitive ova, which is being produced in the body, are no longer maturing and being released, but that process is beginning to slow down and halt. Mm-hmm. When that happens, what people don't realize is that the hormonal responsibility impacts the systemic health of the woman. Mm-hmm. We are very quick to assign testosterone and estrogen to the reproductive responsibilities in the body. They are. However, in their absence, there is a systemic impact, mind, body, and soul. We say that all the time, but they're in the beginning phases, as a woman enters into the menopausal stages, the most impact to a woman is in the mental, almost kind of psychotic realm, is that a woman can feel like she's really losing it.
Yes.
Right?
Well, and that's what I want to speak to on my side of the house of being a woman. And that's why I appreciate your insight and expertise into the viewpoint of what is happening within the woman's body related to hormones. But the other side of that, of this disconnection a woman is struggling with what oneself used to be prior to the experience they're having, whatever that might be. And the point there being is that when a woman is beginning to go through this process and filling all those areas, not to be repetitive, but of disconnection, what is going on and how do I grab hold of what once was? We have the opportunity, we have an individual's case file of blood panels from 2022 to current.
Exactly, yeah.
And a baseline of what transpired during that time.
Exactly. So what you and I will be referencing is, we'll say in this case file from 2022 to 2025, this client patient had blood panels done on a regular basis it was a general health panel. However, they were quite specific, done by a OBGYN who actually specializes now in regenerative cell therapy and regenerative health at a cellular level. So we got to see a very intrinsic panel, and we got to look at all these things. Now, the interesting thing is, and I will touch on this repeatedly, is that it's really beneficial for us to all have a baseline. So having a healthy panel and the small adjustments that were made by this treating physician, we got to watch this female go from 2022 to a relatively good base. It began to alter and finally completely change, right? It literally dropped off. And what I'm talking about here is this person had entered into full-blown menopause.
Right.
Yes.
Correct. And like a freight train crashing, kind of.
Yeah, this was within, let's say, 30 days, this person reported repeatedly that there were changes that just were making her world uncomfortable.
Right. So understanding that turbulence that someone is facing, one of the things that I have really dived into, or I would say looked at a little bit more intensely around this, is the perimenopausal stage is something that we really need to bring more insight to, not just menopause.
Sure.
Because there's actually some proactive pieces around physical health, mental health, and how you're taking care of yourself to not just offset or be prepared, I guess, for menopause, but to be aware of where this plays into. And this is where I want to go into the cardiovascular, neurological, and skeletal part of a woman. Like it's all of those pieces. It's not just your hormones.
So if you'll just walk us through this, I'll give you some detailed breakdown on kind of how that happens physiologically.
Perfect.
Yeah.
The first part is I want to kind of go into that initial part of brain fog with that women are sharing, like, I can't find, it's different when you walk into a room and can't find what you're looking for versus being in mid-conversation and then forgetting your train of thought or not grasping.
Yeah.
That fluency is affected, and it really makes you feel like you're just crazy.
So I will say this, because this is related to reproductive systems. We've all heard of baby mom or baby brain, and that is new mothers or expectant mothers who just can't finish two sentences, right? They are just all over the place. Well, hormones are raging during this developmental time, and the mother is in preparation for delivery of a baby. Well, as we reach a state of maturity in the female body and the ova begin to decline in the output or completely cease, those same hormonal signals have now been altered. And I would say it's very similar because your system, the homeostasis of that system, is so used to working on a regulated release, a regulated dosage of its own mixture, that as that becomes altered, here we go again. Now I've lost my ability to concentrate. I've lost my ability to motivate. I have a focus to attention and detail. Those things begin to slide. That's more of the cognitive. But we also see that fatigue sets in. We start to see that, I mentioned motivation, but the libido will drop off. It can drop off immensely. And as we continue in this discussion,
we'll break all those factors down.
We'll talk about that more in detail, because as that declines, I want everyone to be aware that there's a male counterpart to this just as powerful as menopause, and that affects men.
Absolutely. Yeah. And we will be going over men's health next. And that's something that I was sharing with you earlier. We were doing some pre-show, reviewing that some of these seem to intertwine with men's health and women's health. And I think there's such a lack of understanding of that.
Most definitely, yeah.
And understanding estrogen is one thing that I've really looked at. You think you know something, and then you realize estrogen is actually really powerful for specifically women. Again, I'm not familiar just yet with how that it really affects men, because men have it as well.
Exactly.
But understanding that deficit that transpires that affects everything else, it's impacting multiple systems that you had no idea it was responsible for.
Absolutely. We hear a lot reported in the OBGYN society, more towards, not society, but in the culture of sexual and reproductive faculties. But we talk about how it can affect bone density, osteoporosis. We talk about the likelihood of fractures. Well, we're beginning to understand now that a lot of women, especially women that are now advanced into their, let's say, 60s and 70s, that these fractures that are very common at the surgical neck of the femur as it enters into the acetabulum, quite frequently the bone is so weak it fractures and then they fall. We've always had kind of a basic understanding that someone falls and breaks their hip. No, we actually have some evidence that the bone actually breaks and they fall. Well, that's a dangerous thing for anyone to break a large bone in their body, because we run the risk of very much in a emergent situation where we have an embolism and a complete thrombosis, where there's this huge release of adipose into the blood, and those adipose tissue begin to cause dyslipidemia. We get frothing in micelles. Those become obstacles in the blood vessels. They can lodge themselves in those smaller vessels, but most importantly, at the heart, at the lungs, and the carotid, we get stroke. So these are important things to keep in mind, right?
Sure.
Very much important things.
Well, and I think that understanding how our bodies are operating, and there's a preventativeness that I want to continue to highlight in our conversation around everything that you're saying, that at some point, even if you're already through or in the process of still in perimenopause or been menopausal, for any other individual or woman educating men and women, education around, these are some, how do we take care of ourselves and be aware of what's going on? Now, I don't want to jump too quickly there, because I want to talk a little bit about the protective role that estrogen provides. Now, you and I had an in-depth conversation, and we want to invite the listeners into that, because I've noticed sometimes when I go to review that I will reflect on our conversations and what we were what we were conversing about. So you're aware of the conversation is the increase of LDL cholesterol and the decrease of HDL cholesterol and the elevated blood pressure and insulin resistant that women seem to go through this stage.
Sure.
And you kind of broke that down for me a little bit. That was really kind of helpful.
I did. So a few things to unpack here. First of all, most of what I'm going to describe to you, I am not an endocrinologist. I have knowledge of, and I will break that down fundamentally. But that all of our hormones are essentially
The moans.
The moans.
That's what I call
them. They're all fundamentally constructed on a backbone of cholesterol. Okay. So cholesterol's always been a big topic. And it
Still is.
And it has been this drive to push cholesterol down in the body, stop eating the egg yolks and saturated fats. There's a lot of science has just been completely reversed about the scientific...
They debunked it.
Yeah, the scientific ideas behind saturated fats and cholesterol-related diets. Simply the fact is that 3 generations ago, cholesterols were in the 200s, 300s, and they lived healthy lives. Why is that important? Because cholesterol is a fundamental building structure that has to be built in our body, and dietary intake is typically the chief way of how to work. Now, that being said, modern society, as we drive down the cholesterol, it seems to be affecting, and I say seems to be, science will prove it out, but it seems to be affecting our hormonal maturity rates and the advancement of the menopause, and even that equivalent into men. So we begin to see men who have a rapid decline. We already know this, dietary intakes have harshly diminished men's testosterone. Okay, so when we talk about cholesterol, we're talking about the fundamental building blocks. When we talk about lipids, when we talk about HDL, which is high-density lipids, low LDL, which is low-density lipids, there's also VLDLs and omnicroms. Omnicroms, I think that's the name, yes. But they're all description of essentially the same thing, except that they vary in sizes and concentrations in different components. So HDL is typically higher in proteins, okay? HDL got tagged the good cholesterol because they, in their research prior to, had always assigned the HDL as being this dense lipid that goes around and kind of scavenges from the other lipids. Well, they're finding out that that's not really all that true. they're also finding out that the LDLs and the VLDLs have a very functional purpose too, and that dietary intake doesn't really produce these things. This is all in vivo. Your body makes this all naturally.
Correct. Right.
So I would argue, and there's lots of people who would side with me, is that there's really no good or bad cholesterol. It just is. But when we see the chief hormonal operators of estrogen and testosterone begin to flag or completely...
Or progesterone.
For all of the moans, if they begin to drop off, what we see then is that there can be an aberrant behavior in the way that lipids begin to accumulate in our body. So
Correct.
My dissertation when I was leaving as a doctor was thyroid-related dyslipidemias. Those dyslipidemias, those things that are happening with fats and deposition of fats in our vessels, can lead to harmful deposition within the vessels. So lack of estrogen can drive that.
Correct.
And now
that's where we're going.
But the importance of estrogen, as we see comparatively between the sexes, male and female, and there are only two sexes, is that estrogen has very remarkably kept women pretty much safe from heart attacks. No, not exclusively, but if you compare, males have far more heart attacks than females, and they theorize that the estrogen, I suppose it's beyond theory, but estrogen plays a very important part of that is the protection of the cardiovascular system. Now, I would say that the estrogen has a powerful impact because of the properties in dyslipidemia. It helps prevent loss of bone thickness, which is osteoporosis. It helps to protect the vessels from the dyslipidemias. So I don't know all the research on it. I just know that those properties do exist. And as a result, when those things begin to fall off, you become actually a risk to yourself, right? And I know that might be a little confusing and certainly not very professional, but we need to, that's what's nice to have a baseline. And when we see it start to drop off and we see it completely stop, we need to restore to the best of our abilities to somewhere close to a natural levels so that we can continue to function and have longer functioning, operating body.
Vitality. Yeah.
Vitality.
Yeah,
Exactly.
that's really
Good
what it
word.
comes down to is vitality. Thanks.
Yeah.
I had some smarts.
Yeah.
So, one of the things that, I don't want to clinically overcast, like to be too much clinical language, because we want people to kind of have a natural understanding.
Right. I've never said dyslipidemia more in my life than I just did. Well, go ahead.
Yes. But I think it's important that when we go back to the importance of the role of estrogen and what its protective role is for us, and then when it's gone, what happens?
Exactly.
And I'm almost curious now. I'll be honest. In the research that I looked at, and I know that they talked about that women are at more risk of a myocardial. What is it?
Myocardial infarction.
There it is.
Heart attack.
Yes, a heart attack. The fancy word for it. 5 to 10 years post-menopause. But I wonder almost when you go into the breakdown of cholesterol, when people want to classify it good, bad, or the other, is that you had shared with me about how it can, calcify and break up and create a clot, where people are having strokes are women at higher risk of strokes more than heart attacks.
Yeah, so Ansel Keys, who created the food pyramid, which has been totally rocked in this last 10 years, just terrible information. That whole thing was built on some very terrible premises. But the theory is, let's see, and I'll direct this specifically to estrogen, is that in the absence of estrogen being a part of the hormonal makeup for the female systematic order, is in its absence, now lipids and lipidemia, those problems with lipid deposition and function, have been altered to the point where now they begin to get, what's the term, minobelly.
It is minobelly. It is real.
So they get an increase in deposition at all levels of the body, but it will happen for women. It'll have an increased likelihood that they will begin to increase visceral fat.
Yes. So what I read in that is how the body used to function and how it would naturally push maybe those fats and proportionate to your body. It's not pushing the same way.
Well, it's mostly its appropriate use, right? So Remember, all of these things are contingent and reliant on the other. So if my energy's dropped, my activity has dropped, but my appetite hasn't, it may have increased. So now I'm taking in more calories, I'm working less. And now the energy, which should have been used up in the daily activity, is no longer. Now I have fat deposition. And this is where women will frequently talk about the changes in, let's say, saddle thighs, and they have their bellies, they begin to get more truncal thickness, right? So their slim waist seems to go away, their six-pack goes away, their hip bones kind of go away. All normal for the condition that they're now facing. Is that estrogen played
a significant
in
role
signaling your body to do different things.
Right. And that's when I found interesting is that when I talk about a systems failure and women are I think that sharing that and saying like, I feel like everything is crashing. Sure. That's literally what's happening.
Sure.
And there's a compassion to that.
That's right.
Around that. And I don't know if that's always seen, and especially, of course, this plays a significant role, and we'll get to that around mental health.
That's right.
And you went over osteoporosis and how that you kind of touched on how that affects women. And
so functionally, the estrogen should be signaling your bone to lay down new osteoclast, lay down new bone. And in the absence of the estrogen, that doesn't happen as frequently. And now calcium isn't being deposited. Well, they theorize it's all calcium, but calcium, vitamin D absorption, that isn't happening as it used to. And now these long, powerful bones are now beginning to become more porous. There's more lattice being exposed. And as a result, those bones can't take it and they break.
Right. And I think you had shared that, I can't remember which doctor you were listening to, that said that the high likelihood of death after a broken...
I've heard several. I remember hearing Dr. Lyons speak about it. I can't remember the one who was most poignant about driving home that fact that women postmenopausal, was this specifically women? I think it was distributed mostly to men, but about the age of 55. She may have had a range 50 to 60, but around 55. Those that fracture a large bone, 15% will die from a broken bone because of the fat embolism that can occur. That's a release of all of these fats into the blood system. That's why it's really imperative that you seek medical attention, and they may treat you with blood thinners and all of these things to fix a bone. It doesn't seem right, but they're finding that this is true. Now, there's no inverse. I'm going to say that the likelihood of people who are osteoporotic, and I think beyond 65, 50% of those people who break a bone after that, they'll die. Mm-hmm. Right?
Well, that's really unfortunate.
There's people who are impacted, and there's people who are impacted immediately. And that's tragic. And that one thing that you have heard us say, and we continue to harp about even when I do my stuff on the Genuine Effort podcast and discussions, is that most every disease known is preventable. Mm-hmm. And this is another one that, although it's fundamentally a process that happens naturally, it's still something that we can have some controls over.
Well, and that's what this whole conversation is about today, that in the ears of our listeners, our viewers, that this is awareness, this is education, this is insight to yourself, and seeing all of this, there's something to be done about it. It's not hopeless. It can feel really overwhelming, but it's information to say, now I know what this is or what to do about it, and I have to do something. Right. So continuing on, I want to go into another portion of this is sexual health for women, and how that definitely takes a toll on women, on how their body used to operate. And how they're suffering in different ways. I think their pelvic floor, I was talking to you about that, really gets...
It changes a lot. Even the tissues of the vaginal area, it all changes. It thins. The female begins to have thinning, which can cause irritation, even bleeding. It can make intercourse almost impossible. Vaginal secretions will diminish a lot. And that's one of the signs I always ask clients that will divulge that stuff is, in your intimacy, do you need to use lubricants? Do you need anything? Those are signals that things have changed. Because if it used to be in abundance and now it's not, things have changed. And you should always make that inquiry.
We were talking about UTIs and...
UTIs, that's right. The health of the pelvic floor changes completely. So As the estrogen is absent in the female body, progesterone as well, libido will drop. With that, excess weight may come onto the body. Activity will drop. Libido, I just don't have it anymore. Sex drive has almost diminished. And then when it does happen, it's painful. On a personal, private level, you may develop incontinence. You may develop, in all likelihood, UTIs. You will have the pelvic floor begins to become weak and fragile. The round ligament can let go, and now the bladder drops in. Now you have age-related incontinence, which all of these things are corrected with surgery. But what if we just look at the hormonal balance and see if we can't maintain?
Right. I will keep using the word preventative.
Exactly.
You know, preventative. What do I need to know now? And even if you're at a stage where these things have transpired, we'll go into those pieces
Exactly.
as well.
It's far easier to have vision of what it looks like healthy and try to maintain that to a point beyond, there's a point past maturity and stuff like that, where the effects of the lack of estrogen are not as bad. They just don't impact you as well. But I have clients that are in their 80s, and they tell me that, yeah, ultimately you do have to go through it, but now I don't really miss it, right? We're not that sexually active as a couple. It's just things that they cope with a little bit easier, and all I ask them to do is stay physically active. That helps in all three realms, especially the cognitive.
Well, and I think the one thing that I would talk about is the psychological factors for women. Everything that women probably identify with as being a woman is all impaired, and that's life altering. So when I say that's like, it's hitting all systems there, it's like, what happens now that does this make me not as feminine or, soft or whatever, especially when you are this area of delayed, reaction or dysfunction or what's transpiring, all the things, it causes those things to really come into question.
Now, in fairness and in balance, that is exactly the same mirror image protocols that we see happen with men and ED and erectile dysfunction and their incontinence and their ability to either achieve or maintain. Yeah, absolutely.
Yeah, and I think that's very imperative. Again, we'll be covering that next. And so now I want to go into, so we've broken down the basics of what's going on in a woman's body and her health risk, what she needs to be aware of, and her partners and people, her loved ones in her life that need to be aware of. If you are noticing someone in your life that is, they're not just, it's like when people say, man, she's a mean old woman. And it's like, well, maybe there's a reason she's a mean old woman. Yeah. How about some grace there? We were just talking this morning, and I'm sure that Nancy wouldn't mind me saying this, that she's like, I remember when I would be like, my husband would be like, hey, like, you're a little angry. And she'd be like, oh, I didn't even know, in that disconnection. That's when I say it's really challenging. Like, it's like being able to say, I didn't even know I was getting upset. Like that disconnection is really overwhelming. So we're going to talk about like some therapeutic strategies that are offered clinically, medically, and then psychologically.
Okay, yeah.
So first one is, of course, your genre is lifestyle changes. So they offer, increased nutrition or healthy nutrition.
Yeah.
Calcium. Would that be for the osteoporosis?
Well, okay. So let's look at it systematically and let's look at it appropriately. What's the first thing I'd like to establish is blood work.
Okay.
Got to have blood work. I love it when people, and this is the first time I'm going to hit on this thing, is the baseline. If you will go see your doctor, even when you're not sick, and have some baseline done, every 6 months, especially as you get past the age of 40. Now, I will say that, full disclosure, I had my hip replaced 7 years ago. Every 6 months, I have blood work done. Why? It's because I started TRT. With my hip...
What is TRT, Dr. Caldwell?
That's TRT is essentially hormone replacement therapy.
Yes, it is.
HRT. But mine is testosterone replacement therapy. So as we examined my health related around my left hip is... I had a very old injury. I had systemic inflammation.
Because you're old.
Thank you, Liz. I had systemic inflammation. Now, because I had systemic inflammation, my blood panels were all over the place. I had high indicators, which included high blood pressure. So I took it upon myself to say, when we get this hip fixed, we're starting over. And at that point, I began giving blood.
Yeah, let's talk about that just a minute. We didn't touch on that yet.
We didn't, and we will come back to this because it's paramount. I think it's a paramount
You'll be
thing.
hearing this a lot in our upcoming
You absolutely
episodes
will.
as well.
But
the oil change.
But the ideal is that, okay, we're going to get this hip fixed. I'm going to take care of my systemic inflammation, and I'm going to look at my blood panels. Blood panels revealed my testosterone had tanked. I mean, I had a 56, right? And that's horrible. That's almost non-production. So I suspect it wasn't just related to my age, but my systemic inflammation and pain
good. Very good.
destroyed my normal system. Okay, now why do I bring that up? It's because with women, as they approach, if they have a baseline of, let's say, 2002 or 2022 to 2025, I've been giving blood. I'm having checkups. It's really something to have as we comparatively go through, okay, now this person hit the wall. And we're looking at FSH and LH, the luteinizing hormone, they completely tank. So it's a very clear indicator. I am completely menopausal now.
100%.
I'm no longer peri, I'm no longer sliding, I'm in because those systems shut down. Luteinizing hormone and fascicular stimulating hormone, you can look those up, but I'm shooting from the hip. Those are indicators on blood panels. They have their purpose, but most importantly is that when that happens, I'm able to look back and say, well, let's do something about it. So let's get a blood panel. Let's have an expert make some recommendations as to what can be added back in,
Correct.
if possible. And we need to get into a physical state of better health. I am of the opinion that being in really good physical health, when these things happen, you adapt to them easier, they're easier to correct. I just believe that is true. I mean, fundamentally, in almost 40 years of training, I've seen that completely true, from clients that are in their teens to clients that are in, my dad's 97. These people come to me, we talk about these things, and I'm not telling you I'm the expert, I'm telling you these indicators show, and if you'll speak to your expert, they typically correlate. One of the best ways to get rid of all of this junk that's in our body is doing exactly what I have been a proponent of this thing for almost 8 years now, and that is giving blood regularly. Because giving blood regularly is a systematic oil change. I'm pulling out blood that is full of inflammation, full of all the cholesterols everybody's so concerned about. It's pulling stuff out of their body. Now, those bones, which everyone thinks are just these rigid sticks we walk around on, they're alive. And that marrow begins to produce new red blood cells. The spleen expresses all of this blood that it's held in reserve, and we get an oil change. And then 63 days, whatever they recommend, I drop my blood pressure 40 points in 6 donations. Other people can do that too, and I recommend that for everyone. I have clients who actively give blood now. I appreciate that, and so do they, because they lose, these particular clients, you can see it in their skin. They lose this rosacea. They see these big red puffy faces, and their complaints of systemic aches and pains, they go away too. It's very simple. Now, that in conjunction with an expert's administration and your participation in prescriptive drugs, specifically those targeted for your estrogen replacement therapies or progesterone, they always need to be in balance, even testosterone. Those things can come into play, and now we're getting back into what some people would say is a more regular rhythm for their body. And they feel like, it's all kind of calming down.
There's a sense that it is. Your body's not necessarily on fire anymore.
Yeah, and I don't feel like I'm going crazy, right? And that's a very real thing.
Oh, 100%. And so their preventatives around lifestyle change is nutrition. I was talking about, like, as far as supplements, they're talking about calcium, vitamin D. Vitamin D is always the big one. And you're talking about the movement, the exercise. They're talking specifically about strength training and not just aerobic therapies.
That's right.
Which was something I thought was really fascinating. I thought it would just be aerobic, but it's not.
No. And we'll talk about 2 terms that are really important. That is sarcopenia.
Yes.
Right?
Yes.
And then...
What is sarcopenia, first off?
Sarcopenia is...
I learned this recently.
Sarcopenia is a medical term for muscle wasting, right? So I argue in my profession, have been doing it for decades, is that we're not only over fat, we're under muscle. Now, I'm hearing some great doctors out there, Dr. Lyons, they help push this. I love it. I'm glad people are finally talking about it. Is occasionally you have to lift heavy weights. Not in training, but in your activity. We have to be strong so that two fundamental, let's look at bone health. Two fundamental laws come into play, Volkmann's and Wolff's. That is the need for resistance on our bodies, our connective tissue, and the muscle. That will help the body lay down new bone. Now, if I maintain or get that estrogen back in my body, I can help synthesize new bone. Those osteoclasts begin to lay down good bone. And the chances of going into osteoporosis is diminished, maybe even completely arrested for many, many years. But this has been proven that if you continue this lifting of heavy, I'm not going to be too specific about it, but you need to do some resistance training. Occasionally do some really heavy stuff. Pick up things that are a little heavier and it's not what's comfortable, it's not what your body needs. But as a result of that, your body responds by laying down bones and you have stronger bones.
Yes. So one of the things I want to talk about that came to mind when I was talking about strength training is that I did kind of gloss over this part, and that is that the women during or post-menopausal suffer in their lean muscle mass because it starts depreciating. That's what I was going to say. Well, it's about
diminished.
the same. It's diminishing.
It's diminishing.
It's deteriorating because of the lack of that hormone.
Yes.
And, knowing that that is something, yet again, to be aware of. It doesn't mean that it's something that can't be maintained or built back in. But that's why there is such a need for the strength training
Exactly.
piece. And
now, so the nutritional part in conjunction with the reintroduction of your HRT, the hormonal replacement therapy, by taking in good foods, especially I'm a big protein person because proteins break down into what can be used as usable materials for building muscle. Liz, we've seen that transformation in you. We've seen it in numerous people. I've seen it my entire career. The idea behind that is if I can keep the proteins coming in and your hormonal balances within normal operating ranges, you're going to stay stronger, longer, leaner, and able to ward off these lipid depositions, right? You're able to just stay more active. And sitting is the new cancer. It literally is the new cancer. It destroys everything, not just osteoporosis, but we see degenerative disc disease. We see Bellinger humps. We see people just growing round in a circle. All of that's preventable. All of that's correctable to a certain part. But if it's gone on for years and years, the less likely it is we're going to correct it.
it's a hard turnaround.
It is.
The other part of this, and this is challenging for women that are, even peri or postmenopausal, and that is an incredibly necessary need for your sleep hygiene.
Yeah.
Like your wake and sleep and trying to get, that's going to play a significant role in how you feel overall.
Yeah. One of the things we spoke about this in our earlier discussion, the therapy, the treatment of giving people gabapentin and SSR.
Oh, well, we're getting ready to go over that in
Thank
just
you.
a minute. So that's where we're going. So so it first goes into lifestyle
Excuse me.
interventions, and then we're going to talk about the pharmacological
Pharmacological?
Thank you. Therapies, which is HRT, hormone replacement therapy. And there's a lot of naysayers, I would say, about where there's risk included in that. Always, seek your professionals and your experts on this. I think that with everything, there is a research that will contradict another research. So it's kind of interesting. But
No doubt. That's no doubt.
the benefits of it is obviously symptom relief. It helps protect your heart. It's going to help regulate your mood. It's going to help you with your sexual health, all those things that are being impaired. That hormone replacement is going to help with all that. It also goes into bone protection as well. There are some studies, but I would definitely say you have to look into what are the risks associated therein around stroke or breast cancer and things of that nature that are associated therein. But again, I would always say go to your experts on that before you just automatically not utilize HRT.
Absolutely. And I'm always critical of people who want to become WebMD professionals.
Right.
Do your own research. Look everywhere. Look everywhere. I use my own sources, but look everywhere.
Right.
And take everything with a grain of salt until you begin to hear from people who are very much, they're noted for their accuracy and candid disclosure on here's the pros and cons.
Yep.
That's what you need to hear.
Absolutely.
And you don't want to buy into these snake oil salesmen. These people who sell supplements, everybody's selling something. Find out how you can do that without having to an arm and a leg and a commitment every month and join a club. It's not necessary. You can do this on your own. Takes a little work, but seek out those people who know how and ask around. They'll help you.
Right. Find your experts.
Yeah.
And so when we go into non-hormonal therapies or options, I would say, one of them that is included on there, and it's very close and near and dear to my heart, which is your mental health around psychotherapy.
Right.
Understanding the normalization of like what's transpiring so you don't feel so disconnected from yourself, and how you have to be a little bit more patient. You have to slow down a little bit more and learn how you're processing a little different. I think that's 100% necessary to a point, as finding some grounding around everything that's transpiring in your life. Some other parts of this, they do go into SSRIs or SNRIs, and that's for the mood symptoms and helping you manage that decline. That's what's happening from the lack of estrogen that used to be that protective measure. And that's where I don't want us to, I guess I would say putting fire out with fire, if you will, or unplugging systems. That's what we talked
The
about.
analogy I always make is you're essentially pulling the fire alarms out of a burning building.
That's what it is. I remember there was an analogy of some sort.
And I'm good with analogies. Yeah. Anyway, I always want to point out that I find it offensive that a person come to you and they say, I have this, this, and this, and my blood panels will show this, this, and this. And the doctor goes, you know what? If I just took away your feelings, you wouldn't have all those things.
Right.
Okay, I guess that works. Sure, I could get a lobotomy. I could get all kinds of things.
Right.
But it doesn't
you're
remove the urgency of what needs to be going on. I find that to be incredibly lazy and dispassionate to people who are in real need. They want to sleep better. Okay, I'll drug you. They want to not have hot flashes. Okay, take
Gabapentin.
Gabapentin?
Yeah. I was really surprised at
You
that
want
one.
to take something that makes me think slower and dulls my entire brain? No.
Well, and all of these, and again, these are just our personal opinions on.
They are, yeah.
I want to clarify.
They are.
That, my goal for a person is to stay as much as the person you are that God made you. Like you
Absolutely.
being an intact person, orient yourself to a person, place, and thing that you know what's going on, and you're you. And you're not disconnecting, and you're not, masking or, covering something else up. You want to be yourself. And how you do that is going to be a little bit challenging. You got to discover what that process looks like. That's why I think psychotherapy would really be important.
You bet.
And as well as, I want to know more about what we go to quick gratification. I say that all the time of what is the quickest thing to make me feel better, and I want it now. I want to feel me now. And it doesn't really work like that. There is a process of rediscovery. So for instance, the individual that has the blood panel from 22 to current 2025 is now there is a time that they have to transpire to see where they're going to be going now that they are going to be utilizing HRT, and seeing how that's helpful.
Yeah.
And it is important to note that in 2022, they did start a mild treatment of testosterone and progesterone at that time because they were perimenopausal.
Yes.
So they have already had some. Now they're going to be starting the estradiol into that process.
Yes.
So it'll be interesting to see that progression of how this person is doing and what their symptoms and how the reduction works and all those things.
So interesting enough about this particular patient. This client that we were talking about is on both a testosterone, estradiol, or about to begin a new estradiol progesterone mix. Notice how they're all involved? It's because we all have our own, males and females have estrogen and testosterone. They're at different levels. Males have much higher testosterone and lower estrogen, and the inverse is true for women. But I would always tell people, and I've had patients who came to me, especially when I was still in clinic, and they're typically women in their 50s and 60s, and they're taking estrogen with no progesterone. And I go, well, why would they do that? Well, this is what my doctor wants me to do. So
I see a lot of women that only take estrogen.
It was all the rage to take. No, you need to find this balance. You need to get back to this balance because progesterone has a lot to do with Well, what I might say is the emotional component to some of these things.
100%.
So I might be able to get your estrogen up and your panels look good, but I'm still kind of a wreck. I'm moody. They swing. My cognitive, I can't keep a thought straight. Can't sleep. Still the hot flashes. Estrogen might handle some of those things, but we know that progesterone and testosterone need to be involved in those things too. It has to be a complete panel.
I think it's interesting. I'm glad you mentioned that because I do want to say one thing specifically is there's a lot of women that find it interesting that women take testosterone.
Yes.
And when I tell people that someone's taking testosterone, progesterone, and not, well, this person will be taking estradiol, but they're like, they're taking testosterone and they're a woman. And it's like, yeah, because and that's a major component to their sexual health and their whole overall system.
And their sense of well-being, right?
Yes.
Because testosterone in itself has a bit of an effect that won't make you aggressive, but it makes you more energetic. It makes you, it I think gives you confidence. That's what testosterone does. It's one of the fundamental components of it without bracketing into exactly what it is. Now, I will say this, and we will speak to this about men's mental health too, mental and physical health. Men have been sold this bill of goods. Do you feel run down? Do you feel blah? Well, let's get those T levels up without ever addressing estrogen.
Heavens. We will definitely talk about that.
And I know more young men who have started. Now, remember, I come from a powerlifting, strength, and bodybuilding career. I've seen all spectrum of drug use, total abuse and appropriate abuse. But I've seen young men try to ride this fast track to getting big, getting strong really fast, and they're taking estrogen inhibitors, which blocks estrogen while they're taking testosterone. Well, your body needs that estrogen, and it begins to freak out. And without it, man, you are a mess. I don't think it'd be beyond description to have somebody in the mental health go, man, you're bipolar. You are all over the place.
Yeah.
You're all over the place.
For sure.
Plus, by ridding yourself completely of the estrogen, you raise the risk of your cardiac health exponentially. I'm not sure. Never really looked into that study completely. Most all of this stuff is just stuff I've been exposed to and have carried with me for a very long time. But we can't do that.
Yep.
You can't just take this stuff willy-nilly. You need to be in the hands of an expert.
Absolutely. And that's something we will go over next is men's health and a little bit from going over our health and everything, the same thing we've done today.
That's right.
And so to wrap up, the one thing I'm going to talk about is just the key takeaways that we wanted to make sure that everyone was being able to hear and kind of bring in around menopause is the increase of cognitive decline that happens, depression, osteoporosis, and of course heart health, and how you find your individualized hormone therapy. That definitely seek that out. I will absolutely give my doctor a shout out for Dr. Ray Rogers at Mid-Kansas Innovations for intimacy, beauty, and wellness. It's really a mouthful, but it's really awesome. And she has definitely helped me with my own process in going through my own life experiences around what happens in our body and educating me in that as well. And I would definitely say it's imperative that you have that. So finding your own individualized hormone therapy and what works most effectively for you. And just understanding that this is a physical, mental, and your sexual and emotional health are all very important.
Absolutely.
And be mindful of that. Take care of yourself. And, good
point. Liz, I couple things. Mine is I will always encourage people to establish baseline labs.
Yes.
Right? Let's say if you are 30, as much as they recommend men get prostate and colonoscopies at a certain age, once you're past the age of 35 or 40, you should get your blood work done at least annually. And if there's any markers, get it done every 6 months. If you start a TRT or hormone replacement therapy, every 6 months is a minimum. You have got to watch what's happening. You can't just take something and wonder. That's misdirection. You're ultimately not serving yourself because you could be underdosing, you could be overdosing, and you're going to have all of these problems too that go along with too much of anything. The other is most definitely take care of your health now, right? having good health is what's going to prevent you from having a serious impact when something like that happens. And I will speak to that personally on another episode that impacted me directly. Liz was there. She knows exactly what I'm talking about. But it was my good health that kept me from becoming very much an emergent care.
And the good Lord.
And the good Lord, absolutely, good people around me. The other is I want people to understand that you have control over this. Most everything is preventable. And I liken this, again, another analogy to people who drive a car that's got all these squeaks and rattles, and one day the car breaks down. And they go, I wonder what happened. Well, you're not paying attention to all those squeaks and rattles.
And life is busy. I get it.
Life is busy.
You've got a lot going on, and I don't have time.
Medical stuff can be expensive.
Well, very expensive.
Yes.
And it's like, especially, I'm glad you mentioned that, when people are like, man, every 6 months, I don't know if I can afford that. It's almost understanding you can't afford not to.
You can't afford not to. That's
Right.
that's a great sales point in itself.
You can't afford not to, in the fact that I really need to do this. I just do it and take care of yourself and get back to, who you are. And this is specifically for women today, but I really want to lean in next time to talk about men's health as well.
That's great, Liz. One thing, shameless plug, I want to thank Liz for all her help to get Genuine Effort Body Building Systems up and online. She's a trooper. She did a really great job. And you can locate me on Genuine Effort LLC on most all the platforms, but it's on a Gmail account too. So
yes,
always look us up. But the same thing I do for teaching people how to take care of themselves is I make it affordable to you. For less than a cup of coffee a day, we can get you on the right track, and I'll answer any question you have about health and wellness.
And if you don't know the answer, you'll try and find.
That's right.
Them.
I'm happy to tell you I don't know everything, and I'm not. I hate the word expert. I'm knowledgeable in some things, but we'll figure it out, right? We'll figure it out.
Absolutely. Well, I appreciate you being on today. I hope this was helpful for everyone. And please tune in and definitely go in, like, and subscribe to all of our future episodes.
Absolutely. Thanks, Liz. God bless. Take care.
This show is part of the ICT Podcast Network. For more information, visit ictpod.net.